Good morning, good evening to all of you. I would like to thank you for the invitation. It's an honor for me. My name is Mariana Kotzamanidou. I'm coming from Greece. Hopefully, I wanted to come to Brazil to be alive and to do the lecture, but the difficult time that we all over the world that we spent with COVID stop us from this gathering. So I will try to be very quick and very concrete relating the basic information of the therapeutic method of BadRagaz, the aquatherapy method. So I will start by thanking once again, the organizing committee for the invitation. I have to thank once again Urs Gamper, Senior Instructor of IATF, Johan Lambeck, Senior Instructor of IATF, who are my mentors for this aquatherapy method. And let's start by the introduction of the BadRagazRing Method, which is an aquatherapy method which is established and registered since 2009, officially with the logo and the registration number and the all rights reserved. So talking about the aquatherapy concept, we see many targets, we see many methods that we can apply. And let's see all together how many methods there are and in which area and in which target we want to apply and how we will select the appropriate method. So when we start by our clinical reasoning, we have on the top the mental adjustment, the balance control. Then we want to progress in the movement and then to start the competition level. So on our left side, we see all these levels of progression of the aquatherapy concept, and on the right side, we can see all the methods that already till today we can apply. So talking about the BadRagazRing method, it's fine-tuning and eccentric muscular training method in the water. We will see that the level is very high and the competition also is very high from both sides, the sides of the patient and sides of the therapist. So it's a totally active method where the therapist weight the 100 or the 8% of the active patient response. The technique of BadRagaz demands high precision from the therapist. PNF knowledge is good to know and is prerequisite for the therapist. And also the other factor that is very demanding is the handling. So the good handling and the PNF knowledge is very good to know for the therapist. As we can see, it's me in the water with the patients applying the method, where we can see some accessories that I have to use to the patient, and my handling, my position, as you see here, I'm very away from the core of the body and away from the patient, but I'm handling the patient very well, energizing the lower limbs and giving the appropriate handling so that I can have an energetic response from the patient relating the movement of the lower limbs. Also, another photo from the application of the method. Now you see me in the middle of the body of the patient, applying and fixing the pelvis, giving verbal instructions to the patient, so the patient will fix the body and then wait for my verbal again instructions. So me with the patient together to start doing the movement and having the results that we are looking after the clinical reasoning. Again, another photo of BadRagaz application. In the photo, we can see Johan Lambeck applying a pattern of BadRagaz. Now you will realize a different position of the therapist, which is behind the head of the patient. And again, the basic factor is that we use accessories that we can change the body when we use the body as a big leverage. So we want to activate the whole body, the muscles of the body, and then to transform the leverage either bigger or smaller so that we can have the best muscle activation with a lower torque. So these are the main and the basic accessories that make the difference of the 100% correct application of the method of BadRagaz. And it is a very crucial factor when you know how to use the accessories, where to place it in the body, and why. So when we say that we start applying the method, it's very basic to have on the position of the neck, behind the neck collar, as you can see here. We want a big ring in the height of the pelvis and a smaller ring in the height of the lower legs. So when you have this kind of picture, when you are in the pool and watching a therapist working with these accessories and applying the correct handling and the correct patterns based on PNF, so you can say that you are in a good path. Or when you see any video on YouTube and you don't see this kind of accessories, but you can see something else, and then you have to start asking yourself, is it the correct application or the original application of the BadRagaz? So what are the therapeutic principles? First of all, the patterns and the idea of the BadRagaz is based on the PNF principles. Also in biomechanic principles, because we want to use the body as a big leverage, but we want to know how we will transform the body even smaller leverage or bigger leverage with the less energy consuming. Also, we need to have in mind the hydrodynamics, the exercise physiology, and not to forget that our movement has to be also in the water in the 3-dimension. So if we want to set up our pool or our pool, a pool area for specifically for the BadRagazRing method, we need to follow the setup guidelines. This means that the therapist needs to be immersed up to the 9th thoracic. Also, patient is always, but always in supine position with flotation aids, as we saw earlier in the photo. This means that I need one flotation aid, one neck collar in the area of the neck, one big ring in the level of pelvis in the S2 height, and one smaller ring in the height of the ankle. So approximately the treatment time is about 15 to 30 minutes. The patterns that I will apply may be dynamic or isometric with the variable of resistance. This factor is influenced by the level of the patient and also the level of the handlings and experience of the therapist. We are allowed to apply passive work as passive elongation only between the patterns, but not for the main part of the therapy. So the therapeutic base of BadRagaz is only the diagonal movement pattern, sorry. This means that we need and we are obliged to move or to provoke the movement in the water also in the 3D, 3 dimensions as walking or moving in the earth. This means that I have to activate the body and take results of movement in the sagittal plane, which includes the movement of flexion and extension, the frontal plane movement, which means that I have to conclude also the movement of abduction or adduction, and the transversal plane, which means that I have to conclude in my movement results the rotation. So the combination of these three movement planes will give us the results of the 3-dimensional movement in water, both in earth. The patterns may be symmetric, asymmetric, reciprocal symmetric, reciprocal asymmetric, and the main and the basic parts of the body that will be activated are the trunk, the upper limbs with the shoulder, and the lower limb with the hip. So adapted this photo from PNF in Practice, the book, we can see how the body can be organized in the basic diagonals of the movement. So if we take the clock, and if we can see the clockwise movement, we see that we have two main diagonals that I have to follow also in the body activation in the water, in the supine position. Moving forward, we can see the different patterns that I can apply as therapist. We see in the photo Urs Gamper applying the method. And what we can see is that we have the first pattern, which is the pattern of the legs. It's bilateral symmetrical. Also, I can apply another pattern, which is bilateral asymmetrical reciprocal. And also I can have an adaptation of the pattern where I can have one straight asymmetric reciprocal bilateral pattern for the legs. If we search a bit in the history, we can see that the first BadRagaz publication tried to be on the 1981 from Boyle. But what it was published was not referring in the active part or active participation of the patient. The history of the method leads us from the 1930, where we have the first mentioning for the BadRagaz on from Ott, leading to the 2011, where we have the book publication, which includes the basic principles of the publication and of the method. Also, for our method, for the BadRagaz method, there is the official site of the BadRagaz, which is, as you can see, you can find on the internet, www.BadRagazRingMethod.org, where all the certified therapists have the password and they can log in and find all the information, all the photos, all the videos that you need for the method. The treatment goals, starting from the top of the strengthening, increase range of motion, increase trunk stability, the modulation and the reduction of muscular tone, the increase of local muscle endurance, the decrease of pain, of course, which is the main target and the first target before we start the application, and following the increase of coordination, the innervation training muscle, and the spinal traction and elongation, the increase of functional capacity, and prepare a lower extremity for weight bearing. If you ask me which is the best way or where are the strengths of the BadRagaz methods, I can surely answer you by telling you that if you want to increase your strength, you can apply BadRagaz, and you can see that the symbols are more bold. So also it is suitable for increasing trunk stability, increasing local endurance, decrease of pain, and normalization of muscle tone. What we can get in the second phase of the application is that I can take the muscle relaxation, the increase of range of motion, increase of coordination, increase of functional capacity, increase of balance control, increase of global endurance, but not in a high amplitude as strengthening and the previous factors. So the movement in the water is non-stop. We have the initial movement from the starting point, and then we have the influence of the initial movement transmitted to the next joint as a kinetic chain in the same direction. Relating the treatments, we start from the arm pattern, which is a unilateral pattern where we need to think about the complexity of shoulder. We need to consider that we're working in the medial plane and not as we would work in the ground position. Also, we will see in the practical application that there are many different existing variations of the arm pattern in contrast with the variations that we have when we're working out of the pool. With the arm pattern, we gain mobilization of the trunk, and also we have the strengthening phase of the shoulder complex, and we have no restriction of the use of the techniques. Apart from the arm pattern, we also have the trunk patterns where we use the extremities as levers. We do use the friction and waves as use eddies. It's very important factor for the mobilization of the trunk, the activation of the muscles, the shape of the body that we need to manage, and also the optimal strengthening trunk and legs. We need to consider that one of the two legs needs to be stabilized, and then working the activation of the second leg. And also what we gain through the trunk patterns as well is the mobilization of hip and shoulders. So moving more lower to the body, we can see that we have treatment for the leg pattern, the bilateral asymmetric reciprocal, where we can see that we have isometric length as counter and thrust. Always we need to remember that the painful leg is the isometric leg. And we need to have trunk stabilization, and also we need to mobilize the isometric hip in extension and locked in hip extension. Also mobilize isotonic hip in flexion and use rotation for mobilization. Apart from asymmetrical, we have the bilateral symmetrical leg patterns, where we can see also in the photo Urs Gamper applying a bilateral symmetrical leg where we have low activity, we do have detonization of muscles, balance control of the trunk, of course, and this is where we need to add again and again that the patient needs to be 100% energetic and working with the therapist in coordination. And we do have restriction of techniques and mobilization of hip proximal lever. Until now, we saw the basic principle treatments for arm, trunk, and leg patterns. What's happening when we don't have the appropriate result that we thought at the beginning or before the application of the method, when we can say that the application of the method is poor, and then what we will have as a result is the BadRagaz method, because the therapist approach was passive. There was not good control handling. It was poor. When we see as the movement result that it was only movement in one plane, and what we wait to see is movement in 3 planes. When we have no handling at all, when we see that me as a therapist, I'm not in coordination with the patient, so I have no timing with my patient, so I give my verbal instruction, I have my handling, but I see no movement from the patient. This means that I gave no good motivation, and my handling was poor, my verbal instruction was not correct, were not concrete and quick, so I can't follow the exercise physiology principles, and I can't adapt my resistance of the handling in the area of the muscles that I want to activate. So in general, my application of BadRagaz was poor, and I failed in the target that I put in the beginning of my clinical reasoning. So let's see a nice photo that presents a wrong handling. This means that I activate both agonist and antagonist muscle areas, and the patient doesn't know where to move for plantar flexion or to move in the opposite direction. So when I see no movement, means that I block the patient with a different and wrong handling. And if I see this photo, or if I see live in the pool, this application, or in a video, or in a photo in the internet, I can surely say that it's the correct handling, because I choose on the right side which will be the pattern, the leg of stabilization. This means that this leg with the handling on the base of the foot is the stabilized leg, and the handling, which is this is the basic handling of the BadRagaz in the water, means that I want to activate this area of the foot. So I want to put my correct handling. I want to have the right leg, as you see the photo, to be stabilized, and then to give my verbal instruction and start watching the first activation of the muscle, when the big toe will start to make the movement of extension. Closing my presentation, I want to support more the method of the quality of the method. This is a method that is not only written in the books as a theory, is not only applying in the pool as something new, as a therapeutic method, but it has a very good support in the research area, This means that what we apply, we know that there is that the method is reliable and valid, and we know for which kind of population is available for. So what we see here is photos from the first research approach that Johan Lambeck and Urs Gamper already done, and tested the quality of the handling and the muscle activation that the two senior lecturers would have as a result. And we see here that both have the same muscle activation, which means that the handling of the two therapies were valid and took the same result in muscle activation. This means that it's something valid and we can say that it's worth applying. Another method that we did in order to check and to test the validity of the results of BadRagaz, and also to see the evidence in 3D kinematics is when we try to see the easiest pattern of the bilateral leg, and we saw that there is a 3D joint angle displacement when you try to activate in a bilateral leg pattern. And also what we saw is that for both legs, it was the same results in muscle activation. And the plane that took place, the movement of the leg pattern was a 3D plane. So if you see here, which is why is very important, the correct handling, the correct position of the therapist, and the verbal also instruction. So what we did is that we use an underwater equipment in order to capture the movement in the water and the displacement of the leg during the pattern. And also we wanted to see the contrast of the gait, of the different gait results in the water and in the earth. So that was all from me. Hope that everyone is safe and healthy. Once again, I would like to thank you for the invitation and for the opportunity that you gave me for presenting the basic principles of BadRagaz. Σας ευχαριστώ πολύ. Stay healthy and stay safe. All the best from Greece.